The pain was intense. It was more of a sharp pain that would shoot up my spine. That's how it would feel, like if somebody stabbed me with a knife, pretty much. And then it would shoot through my legs and also make my legs go numb all the time. I pretty much went through treatment for about a year and a half, around there. And in that time, I mean, it was difficult to do many things. I mean, playing with my kids, for example, I couldn't do that, you know, the pain. Or I was constantly fatigued and also angry. So, I mean, that pushes me aside from my family. Going something to as simple as SeaWorld, for example, just to walk around the park was painful. I mean, after 30 minutes of walking and doing just normal stuff, I was just in pain, so much pain that I couldn't go through the rest of the day. I went through a lot of therapy and stuff, and the therapy didn't do much for me. I mean, I was constantly still in pain. Once I spoke with Dr. Deuk, you know, he recommended me to this laser surgery, which I had spoke to another doctor prior to that, and he wanted to do this transplant, I think, where they would put a disc or fusion. Laser obviously sounded better from what I was told. The day of the surgery, I believe I went in like around 12 o'clock. I was there for about an hour, I guess, filling out the paperwork, making sure that all the tests are coming back right. Doctor told me it was going to be about an hour and a half, the surgery, from an hour to an hour and a half. And I went in. I just remember going in, and I remember waking up the times that they needed to wake me up. And an hour and a half later, I was up again, you know. And I believe they kept me there for about another hour or so, and then they let me go. I mean, I went to my car and I went home. When I had spoke with the other doctor, pretty much based on the fusion or the other surgery, obviously they were going to have to open me up. Opening up means that your intestines and everything get tossed around if you get the fusions. The recovery is a lot longer, and obviously to recovery, the first couple of days you would have to be on the hospital. Okay, so that also includes a lot more money. I didn't have to go to the hospital. I mean, I was in and out the same day. I went home. You know, when I was able to look at my scars, it was great because there was really no scar. I mean, you got a little dot in your back, you know, that at the beginning I thought it was in the middle of my back where they had done the surgery, because I didn't notice that I had the dot on the other side. I just thought they go in through the main spine, but actually they go in through the side, and they go in with the camera, and I guess that camera has a laser on it, and they do all the work from there. So it's really undetectable. I mean, I believe I was driving within the third day. I know they told me to drive within a week, but I broke a little bit of the rules. I think I was driving within the third day. I probably could have drove before that because the pain it was barely any pain. I went back to work. I mean, I think it was the third day when I just took those 3 days off and went right back to work. So it wasn't much weight. I didn't really have loss. I could have probably went back to work the next day. That's how the surgery feels. You know, you really don't notice it that much. I feel strong about his surgery. I mean, I really trust the doctor when it comes to laser. I opt for laser versus any other surgery out there. I mean, I think if your doctor says that it can be done, you know, I would go with the laser surgery versus any surgery. I mean, my mom had the disc fusion, and I know they had to train her how to walk again, you know, and I was up and walking, you know, that same day. I recommend Dr. Deuk to whoever has any back problems, or, you know, if they feel like they're not getting anywhere, you know, I was in pain for 2 years, and I didn't know what to do. And you know, doctors tell you, you know, you might just have to learn to live with the pain, you know. But there has to be a solution to pain. I mean, we weren't born with pain. I don't think so. So I mean, there has to be a way to feel better, you know. If not 100%, you know, I mean, try to get anywhere as close to 100%. So I recommend Dr. Deuk to anyone who's having any back problems.